Today we're reporting 44 new cases of COVID-19 in the state. This does include 5 new hospitalizations, 0 new deaths. We have had 81 newly recovered individuals to the point where they're no longer able to transmit COVID-19, and 908 new tests that have been performed. Regarding the numbers, similar to the update that we had yesterday, in order to get back on our 1 p.m. Cut of the data so that we can provide this update and updates on our COVID-19 dashboard, we did maintain that cut and have only cases reported through 7 p.m. Of Wednesday, 7 p.m. On Tuesday through 1 p.m. yesterday, and so that accounts for a total of 18 hours as opposed to the traditional 24, but that helps get us back into our rhythm of cutting the data at 1 p.m. This does bring our total case count for COVID-19 in the state to 8,685 cases. Of those, 866 are considered active infections, and we've had 7,690 individuals who have recovered. We have 44 individuals who are currently hospitalized and 129 deaths. In total, we've had 136,829 total tests that have been performed, and that has been on 110,345 unique individuals. For our cluster updates for today, we have Avera St. Cloud, which will be removed following today's update, as they have had less than 5 cases in the past week among their staff and residents. The totals that we have for you today include 54 individuals who have recovered out of the 69 cases within staff and residents. I did want to also provide an update. We have less than 25 total cases at Bethel Lutheran Home in Madison. As far as an update to Camp Judson, we have 6 individuals who have recovered out of now 61 total cases of COVID-19 among campers and staff. Just to give you a little bit of breakdown of those cases, we've had a age range of cases that extend from the age group 5 to 9 years through individuals who are 40 to 44 years. So again, that 5 to 9 is an age range through the other age range of 40 to 40 years. 40 to 44 years, excuse me. In total, 75% of those that have been identified as the Camp Judson outbreak are among the teen population. The other update that I would like to provide in relation to our cluster updates is that we have identified less than 15 cases with McCrossan Boys Ranch, and that we are continuing to work with the administrators and staff at the Boys Ranch to further identify individuals that may be cases, issue notification of close contacts, and we're working with them to conduct a mass testing event. I'll go ahead and give the number of new cases by county today, which include 1 in Brookings, 5 in Brown, 1 in Brule, 1 in Clay, 1 in Davison, 2 in Dewey, 1 in Hutchinson, 1 in Lake, 2 in Lincoln, 1 in Meade, 1 in Millette, 15 in Minnehaha, 1 in Moody, 1 in Oglala Lakota, 8 in Pennington, and 2 in Roberts. I also wanted to provide just some updates around, we've been getting a lot of questions, especially as we're heading into the school year, around COVID-19 among youth in South Dakota. And so this information is specifically related to those who are 0 to 19 years of age. And so we have, as of Monday, July 27th, we've had 1,003 cases among those 0 to 19 years of age. 322 of those have been among the age group 0 to 9, and 737 have been among those who are 10 to 19 years of age. In total, we have seen a very little difference in terms of symptom presentation between the two groups. 62% have had symptoms in that 0 to 19 year age category, and 68% have had symptoms in the 10 to 19 year age category. For hospitalizations, we have only had 24 total hospitalizations among that 0 to 19 year age category. We have had 46% of those individuals who are hospitalized have a chronic condition, and the chronic conditions that we are listing as part of that include heart, lung, or kidney disease, diabetes, immunosuppressive conditions, neurologic conditions, or an individual being a smoker, either current or former smoker. Among those who have been hospitalized, the breakdown by age group, we've had 4% of our cases that are 0 to 9 years of age have been hospitalized, and 2% of those who are 10 to 19 years of age. For those chronic medical conditions, just a simple breakdown by those age groups include 9% among those who are 0 to 9 years of age, and 18% among those who are 10 to 19 years of age. And again, what is making up a larger proportion of those individuals in that teen population include individuals who are smoking. So it's a good reminder to talk to your teens about not smoking. The other updates that I wanted to provide relate to a FDA recall on hand sanitizer that contains methanol. So methanol is not an acceptable ingredient for hand sanitizer and must not be used due to its toxic effects. The FDA first identified a product on June 19th with methanol containing in the hand sanitizer, and have provided updates on July 2nd and July 27th of additional products. So those are listed on the FDA website of products that FDA is advising consumers not to use. Along with that, I wanted to mention that we have had 3 individuals who have been reported to the Department of Health with methanol poisoning. Now, of those 3 individuals, all of them have been hospitalized after ingesting or drinking that hand sanitizer solution, and unfortunately, 1 individual has died. So again, it is a good reminder that individuals should check their hand sanitizer and make sure it's not one of those recalled products, as we know we have those products in South Dakota, and that methanol is not a product that we want to have in our hand sanitizing solutions that we're using, because even when used on the skin to sanitize the skin, it can still cause dermatologic concerns. So,
with that, I'll go ahead and unmute our lines, and we will take your questions. We're ready for your questions.
Yes, Beth Warden with Dakota News Now.
Go ahead, Beth.
Yes, regarding McCrossen's Boys Ranch, was there a testing event on site, and how many people were tested?
Beth, this is Kim Olsen-Rice, and thanks for that question. McCrossen's has been encouraging staff and residents to be tested. They are in the process of doing mass testing on site.
Hello?
Are you able to hear this?
Yes, I'm able to hear it. You were saying that there's the process of testing on site?
That is correct, and so there will be mass testing here in the coming days for the remaining staff and residents who have not been tested already.
And will any of those tests be sent out of state where there would be a prolonged turnaround time?
No, the State Public Health Laboratory will be conducting the laboratory tests for those.
Okay, and the turnaround time for that?
24 to 48 hours after receiving the specimen.
Great, thank you so much.
You're welcome.
Next question.
This is
Ray
Morgan
from
at the Rapid City Journal.
I heard Morgan at the Rapid City Journal, and then Ray from Keloland. We'll go to Morgan first.
Thank you, and thanks for the data you provided about the younger age groups. With that in mind, is the governor right in saying that it poses less of a risk to children considering COVID-19 and going back to school?
So what I would say is that, the scientific literature does identify that specifically younger kids, there's less of a risk, there appears to be, I should say, less of a risk of transmission, from those children that might be infected to others. So that would be to their other schoolmates, to teachers, staff, or even to individuals within the home. So I think that, this is an area that we do still need to monitor as, the COVID-19 pandemic continues to evolve.
And now we'll go to Ray with Keloland.
Thank you. As far as a threshold for percentage of positives in a community or percentage of absenteeism as it relates to school closings or moving to hybrid models, does the DOH plan to have some direction for school districts in those terms?
So, Ray, this is Kim Elson-Rice, and we're working very actively with the Department of Education as well as school superintendents on their plans for reopening, including mitigation strategies that they can take. We are also working to provide them data so that they can make decisions specific to the situation that they might be seeing in their community and in their schools. Obviously we've been providing information about community spread at the county level, and so that's one indicator that I know schools will be looking at. And then I would turn it to Dr. Clayton for additional information.
Yeah, so if individuals are familiar with some of the different criteria that CDC and HHS are using around monitoring transmission within counties, one of the updates that we do plan on pushing to the website in future revisions include adding whether or not the county is at 100 cases per 100,000 population or more, which is an indicator that there is a lot of additional transmission within the community. So it does help provide an actual magnitude of what that transmission is looking like, in addition to the community impact map, which is focused on that none, minimal to moderate, and substantial transmission. So the hope is that with the addition of that information, it will be additional information that the school and other superintendents can use to help identify the risk of COVID-19 transmission within the community and make appropriate just decisions for their school.
But is there any threshold that, sorry, can I get a follow-up?
Yep.
So is there any threshold, percentage threshold that the DOH will recommend is for decision making?
That is something that is being left to the individual school and school districts. What I can say is that we do work closely with them, and we are providing them information so that they can make those informed decisions.
And Ray, this is Kim Elson-Rice, and I would just follow up. And the reason for that is because the situations that we see with COVID-positive cases are very individualized. And so we're planning to work with schools on that basis so that they can make the best decision given all of the details around any positive cases in their communities or in their schools. It's just too difficult to put a hard and fast rule in place that will be very effective.
Next
Thank
question.
Hi, Todd Epp, Kelo.com News.
Go ahead, Todd.
Yeah, I don't know if Kim and Josh have school-age children or grandchildren, but kind of a two-part question. If you do, or you have other relatives that do, A, would you recommend that they go ahead and go to school this fall? And would you recommend that if they do go to school that the kids should wear a mask?
So I'll go ahead and start. And yes, I do have 2 school-age children, both of them in elementary school. My wife and I have had discussions, and have chosen to send our children to school. And that, just as a general precaution, that, we are looking at providing our children, masks that they can wear in the classroom or during different activities and so on. So that is my decision, that was made, as a family unit of what to do, whether to send my child to school, and what individual precautions we were comfortable having our children take.
And Todd, this is Kim Elson-Rice, and I have a college-aged son who will be returning to USD this fall, so go Yotes. As you have reported, the Regental system has required masking of students, and so he will obviously comply with that.
Next question.
All right. Claudia Contreras with News Center 1.
Go ahead.
So we had heard that first responders in West River would be getting tested for coronavirus prior to the rally in order to help keep everyone safe during the rally. Can you go in depth about maybe how many first responders are getting tested, how many organizations are getting tested?
Claudia, this is Kim Elson-Rice, and I can tell you that we have approximately 500 EMS providers in West River, South Dakota. So obviously we have ambulances that respond from quite a geographic distance to situations. And so we have about 500 people that are lined up for testing starting early, actually probably already this weekend, but certainly into next week. And so we will be able to provide some updates on just how that next week.
Next question.
Thank you.
Any other questions?
Jack Cottle with KEVN and KOTA.
Go ahead.
Can you give any kind of idea as far as the cases at Camp Judson? How many of those are campers? How many of those are staff? And how severe their symptoms are?
The information that we have is that 75% of those individuals are teens. That does include a small number of individuals who would have been some of the camp counselors, in addition to the individuals that were camp attendees, and that the severity of illness has been such that no one has been hospitalized at this time. We have no deaths. And that individuals have had a range of symptoms. Some of them, being simple, cough, a little bit of fever, and individuals who have had more gastrointestinal symptoms. So it has really kind of spanned the gamut in terms of what sort of symptoms individuals experienced.
All right, we have time for one final question.
Yeah, Ray from Kettleland.
Go ahead.
Just follow up on that. How many campers or staffers, how many total people were at the camp that could have possibly been exposed?
So we did have the full list, which included all campers, staff that were in attendance, and that does include, and that list contained 328 names.
328.
Correct.
And then can I ask just one more question related to the amount of recoveries? I believe it was from yesterday or the day before, where they just skyrocketed to like 212.
I guess what specifically is your question?
Well, typically they've been running around 60 or 50, and that just seemed extremely high. Was that just a extraction quirk or?
So it was actually had nothing to specifically do with kind of the data that was pulled and provided for updates on the website or anywhere else. It related to, I think, our ability to get a hold of individuals to get them off of their isolation, and once that happens, they do go into that recovery bin. So those individuals, it just comes down to sometimes the timing in which we're able to get a hold of individuals.
So,
Thank you.
and I'll make my usual plug to help us tell people to answer the phone when we call, because that's, we do check in with individuals to make sure that they are symptom-free and that they're not going to be at risk of transmitting the disease to others towards the end of the 10-day isolation period. And so that's what gets them into the recovered section, which is good for them to get back to work and do those kinds of things.
Thank you for indulging me. Thank you.
No problem. All right. Thank you all for joining us today, and we will visit with you again on Monday.